As he said, I'm Peggy Kane, the VP of Business Development with GLC. We are based in Northbrook, Illinois, and we help marketing departments and strategic planning departments with their communication efforts, both in print and digital, out to their communities and to their physicians. So I have the pleasure of attending the conference with one of my colleagues, Rachel Sobel. So she will be, I actually have another meeting to attend. She will be with you all afternoon, so we hope that you visit with us over in this end of the hall. An added pleasure that I have this morning is introducing my friend Candace Quinn. I'm going to tell you a little bit about her formally, as it says in her bio here. Candace is the CEO and Senior Brand Consultant for Brand Equals Experience. She works with clients across the country, large and small, to develop meaningful, differentiated brand positions for her clients' enterprises. She spent the first 20 years of her career, she started when she was 12, as a Chief Marketing Officer for 3 health systems, and is a frequent speaker and presenter, most recently keynoting the opening session for the New England Society for Healthcare Communications. In the spirit of Halloween, Candace stated that her all-time favorite Halloween costume is Elvira, and if she were to star on a TV show, her personal theme song would be I've Got a Feeling. Candace means a lot to me, and I think you're going to enjoy her presentation immensely. And one of the things that I was struck with was this is a great idea that you brought these 2 societies together to collaborate. It's really not about you all as individuals, but it's about us together, collaborating and becoming friends, enhancing ourselves professionally. So I'm just going to take just a minute, with Rick's permission, I have to do this, is to talk a little bit about us. Not GLC us, but us together here, us, me, and Candace. And hopefully you'll enjoy this and see the value in bringing things together and why we're all nuts about each other. So, where do you begin when you talk about us? Being with you makes me very happy because you're not like anyone else. Yep, you're all definitely very unusual. Wait, that didn't come out right. You're unique. Each and every one of you is unique. That's what's right. You're all extremely good listeners, which is handy because Candace and I are extremely good talkers. You know how to tell a joke. You're not afraid to admit your mistakes or point out ours on occasion. You have a naughty sense of humor, but an unwavering sense of right and wrong. All people that work in healthcare have that. It's true. There are endless reasons why being with all of you and being with Candace makes me happy. You're contagiously enthusiastic. You are unabashedly affectionate, fiercely protective, and endlessly entertaining. I love your mischievous streak, even if it has gotten us into trouble on occasion. Of course, being independent thinkers, we often don't see eye to eye, but the simple truth is, and I think we'll find this at this conference, is that we're just better together. Like I said, it's hard to know where to begin when talking about all the reasons why I'm nuts about you. Honestly, there's only one thing that makes me happier than thinking about it, is thinking about all the wonderful times that we have shared and thinking about all the fun that we still have ahead of us. Thanks to all of the good times and for being a friend like no other. And I hope that you enjoy Candace's presentation immensely. She's a good friend. She's one of the smartest women I know. I want to grow up and be just like her. And I hope you have a great conference. Thank you.
There you go, sweetie.
Thank you.
Safe travels. Well, oh, Peggy, do you like this?
Oh,
Thank you. So forgive me for just a minute while I change the technology. We ran out of computers this morning, so we're using my tablet, and oh dear, what did I do? Okay, I think we're still good. Old dogs can learn new tricks. So I'm thrilled to be here with you all. Thank you very much for the opportunity. Before I get too far into my presentation, a little caveat. First of all, it always is nerve-wracking to see people hovering at the door because it's like we're going to bolt. All right? So as a speaker, there's nothing more intimidating than a crowd at the door, right? It's like, oh, any minute I'm going to say the wrong thing and lose them, right? We've got lots of seats up front, nice and comfortable. These are the best legroom seats, right? Right up here in front. And I promise not to call on anybody, okay? I may get you to raise your hand once or twice, but I promise not to put you on the spot. And then secondly, the other caveat is what wasn't mentioned by our hosts this morning is that all of the speakers are here on our own time, on our own nickel. We paid our own way to be here with you today. So you get what you pay for. All right, so keep that in mind when you're evaluating our presentations. So, no, thank you. It really is great to be here with you. We do have a booth also, so that's the end of my commercial. Stop by. Don't be afraid. We don't think branding should be scary. We think branding is something everyone should be able to embrace and walk their organizations through. And I'm hoping at the end of our time together this morning, you'll feel more confident about launching into a brand evaluation initiative yourself. I feel very strongly it's time for that for every organization, whether you feel you've done your branding or not. There's the whole notion of your brand evaluation as an ongoing long-term adventure. So we'll talk a lot about those things as I go through here. And I really want to start with, so why branding right now, right? You guys are all overwhelmed today with the notion of Accountable Care Act and what that's, the Affordable Care Act and what's that, I like accountable better, Affordable Care Act and what that's going to mean to your organizations, right? Like the conversations going on in the C-suite is about how are we going to survive and thrive in this new environment? Are we going to be a part of accountable care organizations? Which one? Are we going to get the right audiences and the right markets? Well, I'm here to tell you branding is that topic. That's why we're going to talk about branding today, because strong brands will survive and thrive in this new environment, and I hope to show you how. So we don't have a clicker with a tablet. Now you got to use your finger. So don't mind me as I point over here to my table. The basis for competition in the healthcare industry, as I know all of you know, is changing rapidly. You've got cats and dogs talking to each other, right? The competition across town is now your partner somehow. And you're trying to say, well, how is that going to make sense? What if we advertise this and they advertise that? Aren't they still competing with us? How are we going to bring this all together? Strong brands will be the drivers in those partnerships and those new mergers and marriages and relationships that accountable care organizations are going to require. And I hope to help you have some ammunition around building your brand in this short term so that you're much more prepared for the long-term ramifications of what the new world will look like. New value-based reimbursement methods are going to be making a big difference with these care delivery models. And really what's it going to mean at the end of the day to consumers is more access and more choice. Right? And so strong brands are going to need to play a role when there's now more access and more choice. And I can tell you that's what the average person is going to tell you to the extent they understand anything about what's going on right now, other than their personal frustration with trying to get onto the health insurance exchange websites. They're going to tell you Illinois is broken, huge. And you know, aside from all that frustration, they're expecting better access and more choice. Whether or not that will be their reality is yet to be seen, but that is what the expectations are. And the transformation of marketing through web, social, and media and mobile technologies, you know, your brand is going to be just as real if someone has no encounter with you as it is to the person who has an encounter with you. And for the first time, we really have to step back and say, are the virtual experiences we're creating on brand and meaningful and truly what the consumer is looking for? And we are very much a field of dreams enterprise by and large, right? We build it, we buy it, we provide it, they'll use it. Correct? How many focus groups do you do to see would a Da Vinci surgical robot be the right thing to bring to your marketplace? You don't do any focus groups. If the surgeons want it and you can afford it, you got it, right? So we don't do that. We build it, they'll come. So as we think about the web technologies we're using, I'd like to see a show of hands. How many of you have electronic medical records and a patient portal today? Keep your hand in the air if you helped design the patient portal. Okay, 4 hands remain in the air for those of you who are polite and not looking around. 4. What's that tell you? Did anybody ask the voice of the customer before they built the patient portal? No, it probably came with the software that's running your EMR. You get what you got, right? And I can tell you, most patient portals around the country aren't working very well for the consumer. You know, I think I'm probably the world's most problematic patient for a doctor, right? They see me coming because I'm armed with information. I do have that pile of papers, and I have a lot to ask my doctor, and I expect a lot of communication, and I expect a lot back from the organization. So I'm the patient from hell. But aside from that, I now have access to my patient portal, right? I had some blood work done. I thought, okay, this is cool. My doctor's probably really busy. He hasn't gotten back to me about my blood work. It's okay. It's a new relationship. They'll figure me out soon enough. And so 3 days went by. I went on to my chart. No results. A week went by. No call from the doctor. No results, right? So my chart says I can send my doctor an email. So I did. That was 3 weeks ago. I still don't have a return email. But I did finally call the office and say, I really would like to hear my results. Oh, we were just about to call you. Really? You know, the average person wouldn't bother. They would just assume everything must be fine, right? They just wouldn't bother. Everything must be fine. And that was 10 days post blood work. When they told me if I come back to that office and have the blood work done, I'd know my results in 24 hours. So it was very interesting, very interesting. But I can tell you their patient portal wasn't designed with them in mind. I still don't have any lab tests up a month later on my chart. I went in for my mammogram. I'm a very good patient, right? I went in for my mammogram, talking to this wonderful technician. This place has patient experience down really well. And I'm going to tell you some more about them later. But I went in for my mammogram, and I said to her, she goes, would you like us to call you later today with your results? I said, that'd be great. All right, so she says, okay, we'll do that. I go, well, will I be able to just look them up on my chart? Oh, no, the radiologists don't use my chart. You know, major fail. So who designed the patient portal, right? They didn't sit with consumers and say, what do you want from that? So my point is we've got so much we have to be doing. As you take a look at, would you describe your organization as market-driven? I'm not going to put you on the spot because your competition might be watching. But market-driven organizations today, I don't find a lot of healthcare organizations that say we are a market-driven organization. They're cost-driven. I bet you've all been to a meeting in the last month where someone has said, we've got to bring our costs down in order to do well in the new world, right? I know my clients are struggling with costs. A lot of places are quality driven, right? We've got to get these numbers up. We're going to lose money if we don't get our quality numbers up, including HCAHPS, right? But people, our healthcare organizations are not market driven by and large. But if you were a market driven organization, you'd be paying attention to the things I'm going to go over on the next couple of slides here. So I'm not going to read these slides to you. You're going to have access to the slides. But the takeaways from them is really what's going on in your world. Do you understand how the changing economic model is going to impact your local market? Okay, forget about statewide implications. Some of you represent health systems that do have statewide locations, but for most of you, you're worried about your local market, right? So understand how these healthcare changes are going to impact you, because they will. You may not be the first to feel the impact, but you will feel it, okay? And if you don't do anything else in the next 12 months, get comfortable with data. Get comfortable with knowing who's your customer. Understand why they choose you. And understand how tenuous is that relationship. Do they choose you based on something that could go away tomorrow? Are they choosing you because their health plan says this is where you go? And that That could change January 1st. Remember, people expect all kinds of access options come January. Do you know what sets you apart from your competition? Really? Not just what they tell you inside is setting you apart. Do you know what your next door neighbor would tell you makes you different, meaningfully different than the competition? And if so, have you baked that je ne sais quoi into your entire organization? Is it deliberate? Are you delivering that what makes you different consciously, intentionally, deliberately, every day, everywhere? You ask yourself that. Do you know that? And is that je ne sais quoi how your organization prioritizes resources and hires staff and trains staff? Is there a commitment to whatever that is that makes you different, to keep it alive, to sustain it? And how savvy is the executive team? Are they having these conversations with all of you? Are they saying what makes us different? Are they asking you those kinds of questions? And then again, what makes you special in person, right? Or the experience, if you know what that is it also happening virtually for you? And how do you know that? How do you know that? Have you adopted and adapted the right consumer-focused technology? Okay, have you gone in and said, have we tested our patient portal? Have we talked to 20 patients to see, is this working for them? What would they like to see? Are there things we could adapt? Is it okay that radiology doesn't want to play in our sandbox? Aren't we paying them? Aren't they getting patients because of us? Wait a minute, our patients want to see their results online, right? Are you orchestrating deliberate business, clinical, and marketing alignment, really, to deliver a consistent brand experience? Has anybody ever said, gosh, you know, I wish I could check into your billboard. It's really friendlier than your ER. You know, really, are we promising what we're delivering consistently and constantly? These are the kinds of brand questions. This is the kind of data and information you really need to know, because these are tenuous times we're about to face. People are going to feel empowered. They're going to feel they have access. They're going to feel they have choice. And if they've been waiting to exercise that muscle, now's the time. Now's the time. So I've been talking about brands, been talking about branding. You're going to hear branding a lot in the next couple of days. I walked around the exhibit hall last night. Probably 1 in 3 are here to support you with your brand work. What do we mean by that? So what does branding mean? There's so many definitions to pick from. This is always my favorite illustration of branding. But you know, when you think about it, it is really the heart of what we do, right? We want to mark our own property. We want to put a stake in the ground. Our brand is this. This is who we are, right? We're going to assert ownership over that brand, and we're going to distinguish ourselves one from the next. To Starbucks and Nike, a brand means to create and own a meaningfully differentiated place in the market that brings measurable value to your customer. And you're going to hear me talk a lot about Nike and Starbucks because I'm a huge, huge fan of Scott Bedbury, okay? Maybe if we all got together and pooled all of our resources, we could afford to hire Scott to help us with branding. In the meantime, he's written a great book we can all afford. And if you have an interest in brand, and if you're going to work with your organization, I highly recommend you buy Scott's book. It's called A New Brand World. And when you get my slide deck, I actually reference it on a slide, so you'll have the stuff you need for it. But you can get it from Amazon. It's a great read, Scott Bedbury. Scott was the brand genius behind both Nike, Just Do It, and Starbucks, the third place. Your third place, your Starbucks. When Scott went to work, this is not a commercial for Scott, but when Scott went to work with Starbucks, they had 13 locations. Okay, enough said. So, and then I have some more. So let's just see what all the experts say brand is. And I'm going to go really quickly through these. A brand is a singular idea or concept that you own inside the mind of a prospect, right? A brand is more than just advertising and marketing. It's nothing less than everything anyone thinks of when they hear your name or see your logo. It's what benefits you. So the brand is a promise around the benefits you're going to deliver, the promise you make around those. And branding is that process of establishing the positive collection of perceptions in your customers' minds related to your brand. Alan Adamson says that for a brand to be successful, it has to differentiate itself. Okay, we got a lot of consistency going on with this whole notion of meaningfully differentiated. But most important, whatever it is that makes it different or relevant must be simple to understand to both the folks inside your organization and outside. Okay, who's building, don't raise your hand, who's building a brand on your Health Grades Award? Who's building a brand on your Da Vinci? Who's building a brand around super sophisticated technology and expertise? And who asked their next door neighbor if they understood any one of those things? We build our brands around things people don't understand. So ask yourself that when you start to look at your brand. Internally, people are going to say, that's what's important. We got great outcomes. We got great technology. We got the world-class experts. But you got to find a way to build a brand to make that meaningfully different and easily understood to your audience. And that's a challenge for us. I've seen a lot of the ads. I drive around Illinois and Wisconsin all the time. I've seen the billboards. I understand less than half of them. And I'm in the business, okay? So I'm not pointing any fingers. I'm just saying it's hard. And the pressures we face, right? From that chairman of surgery and the chairman of whatever, the pressures we face to talk about what makes them excited in their professional world, to talk about that as if it means something to the next door neighbor is huge. So I respect that. I understand that. I've had clients that have a billboard on the way to the CEO, from the CEO's house to the office. I understand that. So I know the pressure we're under. So what we feel in our organization is that the brand really is about the experience. I know how I feel when I leave my doctor's office. I either feel informed, enlightened, I understand what my challenges are and what I'm facing. I feel confidence. I can feel supported, encouraged. When I leave the hospital ER, I can feel respected. I can feel valued. I can feel welcomed. There are all kinds of things I can feel. The brand is never any better than the last experience someone had with any part of your organization and how well you live up to the things you're promising. Quality isn't going to matter to me if I don't know what I'm supposed to do when I get home with the medication or the therapy or the treatment you told me I need, right? It's not going to help me. You can have the best quality outcomes in the world, but you probably won't have the best quality outcomes in the world because if patients don't understand, they can't comply, right? And patient compliance is a huge driver of quality measures. This is probably the most important slide in the deck. Brand management is a business strategy. There is not a person in this room that owns their organization's brand strategy. You are simply there to do your role in a successful brand implementation and brand management. But it is a business strategy. And I can't tell you how many times I walk into a client who's called me and invited me in and say to them, why am I only talking to marketing? Well, we've got to do branding. I said, great. When do we meet with the rest of the team? And so we're going to talk about the value of a brand team as we go through this process and what a brand team does for an organization. And the most important thing a brand team does at the end of the day is underscore this notion that this is a business strategy. And it has to include the CEO. It has to include the entire C-suite. It has to include your physician leaders. It has to include the board's support and buy-in. Because a brand strategy is going to definitely have operational implications. There is no one with a brand strategy that's working today that doesn't affect operations. When's the last time you saw, other than a grand opening of a new store, you actually saw a Starbucks ad? Do you think their brand strategy is their marketing department? No way. No way. So we'll talk some more about that. I like pictures. This is a very busy slide, but I'm going to break it up and we're going to talk about certain elements of it because I think it's important as we talk about brand, we understand everything that makes a brand a brand. And when you work with folks and you even read books and you talk to people, they'll throw around phrases like brand promise, brand strategy, brand position, brand equity. So I'm doing my best to kind of give you some working definitions of all those things. But the bottom line is building brand equity, really coming back with a very strong brand at the end of the day, takes more than just how well your advertising works for you, right? So brand equity is really the function of the strength of your product. I was at the booth last night, and I had a gentleman come up to me who's here speaking to you guys about building a brand experience. And he came up to me and he goes, what do you do when you do all the research and you find out that the reputation of the hospital you're helping is you only go there to die? What do you do? You know, and I said, well, that's a great question, because, you know, you really can't make a silk purse out of a sow's ear. You know, you got to have a product. Product strength is critical. So if your CEO is in the marketing department saying, we've got to do this and do this and do this to build the brand, and your outcomes are in the toilet, you have to have the courage to say, and what am I going to promise them? We'll give them a nice death? You know, what am I going to promise them? We've got to have the quality outcomes. We've got to have a good product. We've got to have capabilities, right? You've got to have the competencies. You can't talk about a heart program when the only thing you can do at the hospital is an EKG, right? You don't have a heart program. And so you have to understand, what can we say? What can we build? Who are we? What do we have? So product strength is huge. I'm not spending any more time on it, but product strength is number one. Market strength. Market strength can really make a difference on brand equity. And what I want you to understand here when I talk about market strength, it's about capacity. It's about having access, being accessible, you can overcome location if everything else is working. But sometimes location can be one of your greatest obstacles. And other market barriers, participation in health plans, right? So access, participation in health plans, being able to work that, huge piece. Market strength plays a huge role in brand equity. And then finally, we'll talk about brand strength, and I've got a couple slides on that. So when we talk about brand and market strength and their interaction, I like to talk about push and pull. So a lot of you have had marketing courses and marketing degrees and what have you, and you all learned about push and pull back in the Marketing 101 class. But when I like to think about market strength and brand strength, I put them into those terms. So you want market strength to really push your customer to you, right? So market strength is all about your location is drawing people in, your physicians are referring in, referring physicians people are referring to your referring physicians, your specialists. You have market strength when you think about the programs you offer and the mix that you have. And again, those health plans are really critical. And then brand strength is that pull. It's that magnet. People know about you. They've heard about you. They know what your promise is. It resonates with them. It differentiates you from the competition. And that brand strength is working like a magnet to pull people towards you. They're going to choose your physicians because they can't imagine going to an enterprise that wouldn't include either your flagship or all the key aspects of the enterprise that make your brand as strong as it is. So you can't just focus on one or the other. And the process that we use at Brand Equals Experience really gets you through that first phase of understanding product strength, market strength, and brand strength right up front, so you know what your demons are, where the windows of opportunity are in your marketplace, and what's going to really set you apart. So let's talk a little bit more about those elements that go into brand strength briefly. This is a very busy slide, hard to read. I'm sorry, I'm not going to expect you to read all of this. When you get the slide deck, you can certainly do that. But I want you to look at the brand promise is the dark blue circle, somewhat not in the middle, but in the surrounded by the rest of the brand elements. So the brand essence, what are those 3 or 4 words, right, that everyone uses to describe your organization? What 3 or 4 words really describe you? Okay, so the first time I asked the question without probing a little bit and helping a little bit, I get caring, quality, compassion. Okay, all of you probably had those running around in your head, right? So you got to get deeper than that. You really have to get deeper than that. Maybe that's at the essence. But how do we get deeper? I say, well, you know, what evidence do you have of that? Give me some examples that support that. What do you have that tells you you're about caring, quality, compassion, right? And what do you think the guys across town would answer that question for their organization? So how does that make you different? In what ways does it make you different? And before long, I'm able to find, no, you know, the 3 or 4 words at the core, at the essence of that brand are really a little more distinctive. And because of that, then I say, well, then are those relevant to the customer? How is that relevant to your customer base? So you talk about brand essence, you talk about that, and somewhere in that you start to see a brand promise forming in the words that people use. And we look outside and I say, well, what visuals do you use to really bring your brand's voice to life? What is it you use? Do you use all physicians? You know, most people don't use some of those words to describe physicians. And if that's what you're using as the visual of your brand, are you really saying this is who we want to be with what we're showing? If you say, well, we use our Da Vinci, you know, ooh, there's compassion and caring for you in a steel package. Yeah, right. So you see what I mean? I mean, what are your visuals saying about who you are as a brand? And what's the brand personality? And I'll tell you, that's my most favorite question to ask CEOs and chairmen of cardiology and surgeons. I say, tell me about the brand personality. And they look at me like I have 3 heads and say, this is why you're here and we can't do this. I say, no, let me make it easy for you. If you were to describe your organization in terms of a famous person, place, thing, something that I would just be able to say, oh, yeah, I know what you mean. What would you say? Oh, do I get some good answers to that question. I was working with an inner city hospital in Philadelphia, and a large academic medical center, and I can't for the life of me remember which clinical chairman said this to me, but he came in ready with this question, right? We're just like Walter Matthau. So I can't laugh, right? I can't do that when I'm interviewing this person one-on-one. So, you know, what's your next step when someone says that? Well, tell me why you say that. Walter Matthau. Well, you know the characters he plays, really. His personality, he's always playing these guys who are disheveled, right? Messy. He goes, you've walked our halls. We got carts over here. We got IV poles over here out in the hall. You got to work your way around boxes of this and carts of linens and what have you. We're a mess. And he said, plus, he goes, this is an old facility. Now, I know those floors are clean because I watch the housekeepers scrub away at them, and they still look old and dirty when you look at them. He goes, so we're disheveled. We're just like Walter Matthau. And he goes, plus, he plays those grumpy characters, right? Right? He goes, you've walked our hall. He keeps going back to, you've walked our halls. Maybe he's seeing me like this ghost or something, but you've walked our halls. He goes, when I walk the halls, the only one who smiles at me is you, and you're from the outside. You don't know any better. Seriously, this is a chairman. This is a physician talking to me. And so I said, okay. He goes, but you know what? Every one of Walter Matthau's movies, at the end, you like the guy. You come to understand him. You know he was good at the core, he's a good guy, and you really like his character. When our patients leave here, they go home better than they came in. Now he's starting to sound like a physician, right? They were safe under our care. We restored their health. They're better than when they came in, and they love us for it when they go home. See, we're just like Walter Matthau. But he told me so much about the personality of the organization and the real struggles they're going to have with establishing a brand position. And he also told me what's going to be relevant to the target audience. I learn a lot with that question. So if you want to have some fun, even with your own marketing departments, go back and ask them, if you could pick a famous person or place, what would it be? But you got to ask the next question without laughing, why did you pick that? Because it's in the why that you'll learn a lot about your organization. And if you want to hear more fun stories, stop by my booth. I'll tell you lots. I've got lots of them that folks have come up with. So brand personality, key important thing. So the second wheel in the brand strength is the architecture. I can't tell you how many times I even get RFPs this way. Someone sends an RFP out because their job, we have to rename the organization. And they say, it's a branding project. No, it's not. It's a naming project. It's not a branding project. Now, it should be a branding project because it should include everything I'm going to talk to you about later about what you do when you do a brand project, because the name is critically important to the strength of your brand. And so we'll talk so much more about that as we get through this. There's all kinds of different architecture structures. Most of healthcare is somewhere in the branded house sub-brands category today. The strongest healthcare brands, so let me say that a different way. The strongest healthcare brands are in branded house and sub-brands. They have discovered that there's no point adding confusion to healthcare in what you call yourself. Let's make it easy for people to know who they're going to, who runs the place, who owns the place, and what it's affiliated with. If you're ashamed of a part of the enterprise, then fix it. Don't hide behind a different name, okay? So that's where most of healthcare, the strongest healthcare brands reside, right? But there is a full stream, and as we look at accountable care, I can't tell you how many accountable care organizations have broken down over what to call it. It's not rocket science, but it is science. You can learn what to call it. And the value of research as you go through this process, which I'll share with you in the last section of the presentation, is about how research can help you with all of this so that you can do it right. Right? And there's a lot of agencies here today, and they'll tell you that the trend at SHSMD, we all just came from SHSMD, and without exception, they were talking about, the days of the computer-generated name for an organization. And you know what? I'm old. So I'm not ashamed to tell you, the first 6 months in my job as my very first hospital in downtown Chicago, it's a really nice townhome area now, but that first hospital job, I went out and bought a software that let me create names. And I could plug in all kinds of stuff and it would spit out a name. And some of you have organizations that were named that way, that you're living with. But wherever you are today, understand the value of what your name brings as a part of the brand strength before you allow anyone to make big changes to it. And see how you can maximize the strength of any elements of your brand as you look to expand that brand. And then finally, the experience. I feel so strongly, and since I created my company, I feel so strongly that the brand can't be better than the experience. That's what I named my company. The brand is the experience. And so I'm going to spend some time on that. So there's really 3 states of experience, right? There's that expectation before you have an experience. And I'm going to tell you another story about my recent mammogram. It's so fun to be new to a healthcare market. So I made this appointment, right? Really easy thing to do, made an appointment. I got a reminder email right after I made the appointment. And I got a reminder on my chart that I had an appointment. So I'm going to go my expectations. This is my chart. It's going to be a cool thing, right? But the radiologists don't play. But the appointment schedule plays. So I got a reminder there. Then I got a phone call, and then I got another reminder. So I'm thinking, wow, they really value time, right? What's your expectation? I'm going to get there on time, and they're going to take me right in because they know I'm coming. They've been planning for me for 4 days. They know I'm coming. So I'm really, really super excited. So I have expectations before my experience. Now I have the actual experience. Walk in the front door, check in. They know me. They go, you have a nice driver's license photo. And she's looking at her computer screen. I didn't pull out my license, so it's in the chart. And she said, we're so glad you're here. Your files have arrived from Virginia. We're good to go. Come on, I'll take you right back. She takes me right back. I get dressed. I no more than get the gown on, and in comes the attendant looking for me. And she takes me right back, and I'm out 5 minutes after my appointment time. So now I have an experience to go right along with those expectations I have. Pretty good so far, right? The third piece of that experience is my brand memory over time. I just told a room of 100 and some people about that experience, right? So there's my brand. Boy, I bet they're glad I didn't tell you they kept me waiting 30 minutes, you know, major fail. They didn't. And you know, the marketer in me was like, I just wonder what's going to happen next. You know? So I had my experience based on, and it wasn't anything they advertised, right? It was the expectations they set for me with those interactions, and I hadn't met a soul yet. Hadn't met a soul. Okay, Scott Bedbury, another reference. One of the most powerful things I heard him say when I got to hear him speak at a keynote was, great brands connect to timeless human needs. How powerful is that? When you think about it, absolutely they do. And I think about all the great brands, and they all do this. They make you feel safe. They make you feel welcomed. Make you feel recognized. Notice everything says feel, by the way. Feel valued. Part of something bigger. Rewarded for your efforts. I made a point to be on time for that appointment, right? Feel loved. Feel love for someone else. See, a brand relationship should be reciprocal, right? I should feel that they care about me. And in return, I'll care about them, right? Feel empowered. How many of you can say right now, there's nine aspects right there, that when people leave your ER, they feel at least 5 of those 9, right? Isn't that sad? Wouldn't it be great? I'm going to assume you actually do, because you just didn't want your competition to know you're that good. But wouldn't it be great if when someone left your emergency room, we had touched every one of those basic human needs? Now, they may be left okay clinically, and we maybe did what we needed to, but I cannot remember a time registering in an ER where I felt like I was welcomed. Really, right? You know, what do they do first? They triage you. Maybe you shouldn't even be here. You don't go into triage and feel like, we're so glad you're here, you're in the right place. You're now one of our priorities. And you don't have to be bleeding to death. Magic words in an ER? Chest pain. Oh, I'm sorry, I know that. Managing your brand over time takes a real commitment, takes a lot of effort, and it takes a lot of leadership. Again, brand management is a business strategy. It's not a marketing and communication strategy. Evidence clearly shows that brand building, it's an investment. It's not an expense. It's not a cost. It shouldn't be a line item, right? This is an investment. I have argued till I was blue in the face with my finance guys when I wore the hat you wear for 20-some years, that brand work and the development of a brand is a capital investment. I never won, but I argued. Okay? It's a necessity. It's not a luxury. Oh, we'll get to that branding stuff later. Yeah, well, the competition eats our lunch, right? It's a priority shared by the most successful companies. Starbucks doesn't start a meeting without understanding how the brand's doing, right? Nike doesn't start a meeting without knowing how the brand's doing. And Scott doesn't work for either one of them anymore, right? I mean, he probably still consults with both of them, but he's not on their payroll anymore. It's not about how good the marketing person is. It's about how strong leadership is. And I mean leadership collectively, not just the CEO, not just the Steve Jobs of your organization, right? If you don't think leadership's important to a brand, remember what happened to the Apple stock prices as Steve Jobs' health started to fail visibly, and it was known to the world that this was not going to be a good outcome, right? Strong leadership's important, but look at how quickly it rebounded, because Jobs did what any good CEO would do. He made the brand strategy a management imperative. There isn't a manager, there isn't a leader at Apple. Did I say Starbucks? I'm sorry. There isn't a leader at Apple who doesn't know the power of that brand and what that brand means, and everything that happens for the brand and maintaining the strength of that brand. Consistency is so critical. And another thing that Scott Bedbury talks about a lot is unleashing the human potential of your brand. Understanding that for all of us, especially us, right? We are in a very intimate organization. What we do is we get very intimate with our patients. Now, I'm not talking about getting personal. all right? Because we mistake getting personal with being intimate with our patients, right? We're unclothed. We're talking about our most human needs as patients, right? And we have to recognize that and appreciate that. It's not about getting personal, right? I don't want to be sweetie. I don't want to be dear. I don't want to be honey. I'm not that thing to your nurses and doctors and techs, right? I am a person. I am a person. So hiring and training practices are critical. Realize that managing that brand over time, I go back to my Starbucks analogy. Baristas don't just happen at Starbucks, right? They hire for personality, they hire for commitment, and they train to be a barista, as Starbucks envisions that role. They're trained to have memory management skills, so that when I walk in and I want my blonde with non-fat cream and Splenda, they know me when I come back 2 days later, 3 days later, 4 days in a row. They know me. And you know what? They gave me an app on my phone that knows me. And I get rewarded for going in. And I tell you, they've just done it right. And I don't even really love the coffee. Right? So with product strength alone won't always do it, right? They had to do everything else. What happens if you need a computer, you need wireless really quick? What do? Even if you don't buy a cup of coffee, you pop into Starbucks, because they've given you a third place. And that's what their brand stands for. Out of Scott's mouth himself. Their brand stands for the third place. You've got home and you've got work. Starbucks wants to be your third place. Your Starbucks. So think about that. Think about the power of that. You want to be the home for healthcare for the people in your communities. You want to be a place. You want to be more than just cardiology services, right? You want to be a healthcare home. So you have to think about what that means and how you can accomplish that. So the how. This is the meat of it. This is where I promised you I'd do, and I'm actually on time. I'm so proud of myself. So a couple caveats before I get into the how, right? This is a model that we use at Brand Equals Experience. I've talked to dozens of my colleagues. Their models are similar. They may call them different steps. We all like to use names for things. I've talked to lots of folks who do this and who help other organizations do it. The essence is the meat of the process. So whether I call it discovery or design or whatever I call it, it's about the work that gets done. And there's so many important steps you can't afford to skip. So whether you do them in the sequence I'm going to present them, or maybe you shuffle the deck a bit, it doesn't really matter. And I can tell you as many times as I've done this, there's always something we do a little different. So it isn't important that you follow our cookbook. It's not a cookbook. It's basically, I'm going to give you all the ingredients and you have to make it work for your family, right? So that's what we're going to do. I like this model because it's practical. The title of this was Branding on a Budget. You can't afford not to do it. I'm going to give you an affordable model, an affordable approach to do it. It's reliable, and the best part about our approach is it's inclusive. I go back to branding as a business strategy. It has to be inclusive. So help me, if you sit in your marketing offices and you've got the marketing team and your ad agency, and I love agencies, I include agencies in my process every single time, right? But if that's all that's at the table, you will not be successful with your brand strategy. Because your agency, and probably you as a department, will not have the clout it takes to make the changes in the organization so that people walk out feeling those 9 human needs were addressed. Does anybody disagree? So as we go through this, you'll see how we include all of those important thought leaders and important partners in making your brand come to life. So let's get started. Sorry, come on, there we go. I break the work into 5 buckets, just because I like to carry one thing at a time. So I break it into buckets, but I can tell you I get a lot of leakage in my buckets. Sometimes we're into design and we're not quite done with discovery, or we get some design work done in discovery, but that's okay because it worked out well, or we saved some discovery elements for the design process because it made sense to do the consumer study then. So I'll walk you through the most important things to do, worry less about when you do them, all right? As you look deeper into these phases, some of the caveats, okay? First of all, This can take some time. Some of you are from pretty big organizations. You know how hard it is when you have to have a meeting with anyone other than yourself, right? It can take some time, right? So this just schedule management can take your process from 90 days to 9 months. I know that. I've had processes take 90 days, and I've had some take 9 months. So don't get bogged down with how quickly can we get this done. It can go quickly, but it's really going to be driven by how your organization works. And this has to be tailored for how your organization works, right? But brand building's a journey. It's not a destination, right? So if the CEO or your executive VP to whom your department reports walks into the office and say, well, we got a brand goal 3 years out. You could say, well, okay, well, what is that? We're going to have a brand in 3 months or 3 years or whatever. There are certain key measures as to how well the brand's performing that you can track annually and should track annually. But establishing a brand goal for any point in the future is a bit, what it indicates is they don't understand what they're asking you to do. So bear in mind that it's a journey, not a destination. And part of the work can be tracked and achieved over time. And there are some measures for how the brand's performing. But they should be complex. They should be inclusive. They should include revenue generation. Because no brand is any good if you're not getting more business, right? I don't care how aware the world is of you. If they're not using you, your brand is not working for you. So remember that, okay? The process requires rigorous evaluation and feedback. And so as I talk about some of the research we do up front, recognize that a lot of the research should be ongoing. Should be something you do at least annually, maybe every other year if that's all you can swing financially, but you've got to continue to do that evaluation. So let's dive into discovery. So the discovery phase of the brand exercise is really about looking at the brand's performance in the market, both historically and today. You want a sense of where are we coming from, what have we been telling the world we value, what have they heard, what do they believe. It's really about understanding not only its performance, but also its aspirations. Right? So where does this brand want to be?